Welcome back to the Midlife Rebrand Podcast. This is episode 15, Midlife Glow Guide.
Okay. Because we did a repost a couple weeks ago, we had to kind of skip an episode.
Yeah.
The way our editing platform works. Either way, great. We'll take it. We're one more podcast ahead, so woohoo!
Yay, look at us go. We were just chatting. We both just made it through hockey evals this weekend.
Ring out evaluations, hockey evaluations.
Our first time here. How many times you've been through it?
Lots of times, yeah. Different emotion levels. For me, my kids are very competitive, and when we get the results of every skate, there's good emotions, there's bad emotions. I'm highly stressed because I'm a control freak and I just want to know what's happening. And you're having all the first timer sad emotions, sad, happy emotions.
It is. It was crazy. I had no idea what to expect. And my kids knew how to skate forward. That is about it. And not very well, but I was like, you know what? Everyone starts somewhere. We just got to start.
Yeah.
You're not bad at it. You're just practicing. You're learning. And my little 6-year-old, almost 7-year-old, went on the ice with all of these humongous kids who could skate circles around him. And he was so nervous. I was so nervous. They had to do these drills. And I'm like, oh, my God, he doesn't know how to do this.
Yes, I remember that.
Oh, God, my heart just sunk. But he stuck it out there. The coaches on the ice taught him how to skate backwards within 30 seconds. He was able to kind of make it down. And
good for him.
And then I was almost crying because these parents beside me, they're like, what's your son's name? And I told them, and they were cheering so loud every time he went, and they were encouraging him. And I was like, this is hard. Okay, I'm so glad I'm here. I'm glad that we're trying this out. Everyone was so kind to him. And
I'm not sure if you guys can see, but she's getting a little teary-eyed.
Because you hear these things about hockey, how competitive it is, how everyone's pushing their kids and I mean,
feels intimidating.
Yeah, I'm sure there's that there too, but to have that support for this little kid who did not even want to step on the ice because was so nervous with all these big kids.
Yeah.
Even in the change room, these dads were talking to him. They're like, don't worry, we had these kids just starting last year. By a couple weeks in, they were going like crazy. And
that's a good experience.
It was the best experience
Hopefully
ever.
you end up on a team with those lovely parents.
I hope so.
So that you can continue in that experience.
Yes, it was so sweet.
That's awesome. I would be totally the same, especially now in my midlife. I'm far more emotional than I used to be. I used to be a little harder. But even I attended the rodeo here in town a couple weeks ago with some friends. I haven't been to a rodeo in a long time, and it was hot as balls.
Yeah.
So, of course, we were wearing minimal clothing, and every time something cool would happen in the ring, I would get these goosebumps. And then my girlfriends would be like, oh, my God, pull it together, man. It's just the rodeo. And I'd be like, oh, but look, she did her trick on her horse so nice. And, oh, look, that boy didn't die when he fell off his bull. I was so emotional. I was like, oh, my God. I need to get it together. So I get it.
Gosh.
I
We
would
just
be
wear emotions on our sleeves. I mean, that's somebody's kid that really tried hard to get there. And
Totally.
I'm so proud of all of them.
Yeah, I get it. So are you out of it now? Out of the evals?
No, we have more in a couple weeks. It's very hard to figure out when we're going, what we're doing, where we're going to be. But
yeah, we're out of the eval phase, waiting for teams to be named.
Oh, okay.
Yeah, so now, the whole waiting, are they on a team with friends? Are they on the higher competitive team? Are they blah, blah, blah? It's another whole round of emotions.
See, for me, I don't have any of those emotions because no matter what, they make a team. And we're good with that.
You should live there for a little while. Enjoy that space.
This year, we have no expectations. Of course, we'll be on the lowest team, and we're totally okay with that. And we will go from there.
Great. And low expectations.
Yeah. No, low to none.
That's
we're
right.
We're going with it. But I'm just happy that I'm not dragging them to their sports, that they want to practice. After school, I'm taking them to the rink because that's where they want to be, just to practice, and I'll show up for them.
Awesome.
I love it.
Love it. Good. Yes. Having a sport that your child loves makes all the difference in the land.
It does.
Honestly. Yeah.
It's exciting for all of us.
Nobody wants to take anyone anywhere kicking and screaming.
No, I refuse. If you're not going to enjoy this, then I'm not doing it. You have to finish because I spent a lot of money doing it, but No, we're done.
The money, the equipment, and
My
all the
gosh,
things.
$1 million just
Yeah.
down the drain in this
Yeah.
September.
Yep. Broke timber is what one of my
Yes.
girlfriends used to call it. I was like,
God.
yes, so true, so accurate.
And I have a birthday in here now with
Yeah.
my little one, so that's another expense. And oh my goodness, it's
On
crazy.
and on it goes.
Mm-hmm.
So we, thought coming off the back of having our first guest on the podcast, I got to thinking and I was like, wait a minute. We have an in-house guest all the time that we're not even using to our advantage. So we thought today we would spend a little time revisiting some things that make you feel good in your midlife physically.
For sure.
Right?
Yeah.
Physically?
Yeah,
Cosmetically?
on the outside.
On the outside. Yeah.
With the nervous system, with jiu-jitsu, we really work on internal stuff, feeling better about our midlife. And yeah, today we're going to talk about the outside because we all want to just look a little bit
More like
refreshed,
ourselves.
more like ourselves, so we can show up like ourselves.
Yeah.
And
I had this little, I think this is suiting here, but there was like a myth that I pulled off of Chat GPT, our favorite
favorite.
friend. Yes. The myth. Botox will make you look 25 again. The truth, Botox will make you look 40, but rested and less like you've been in a permanent staring contest.
Mm-hmm.
And I was like,
There you go.
oh, yeah. So really it's not going to take like years off your life,
No.
but it is going to make you just look more refreshed.
Yeah. And I think for a lot of us, it's more preventative too. Like,
Yes.
we always see like mini talks or mini Botox in these younger ages, and I don't think that there's such a thing. Like,
I don't think that's
It's-
necessary. Is it
no,
necessary?
it's all doing the same thing. But
These
for
people have
everybody,
too much money.
for everybody, we want to prevent those deep lines. Unfortunately, for some 20-year-olds, yes, those deep lines are there when they're not moving. So that's why they get it, and I totally
Yes.
understand.
Bad genetics.
Yes.
Sorry
it's-
about your DNA.
Yeah, exactly.
Yeah.
Exactly. So I get that, but you don't need like thousands of dollars worth.
Yes.
I think ever, but to each their own.
So question before we get into the mix of it all. Since our last little Botox episode aired, have you had any requests for Scrotox or Holtox?
Absolutely not. It is not an option at my
Darn.
clinic, but I actually have seen on social media a lot more providers talking about it, which is, I mean, there's a demographic for it, so go for
There's
it.
no limit, clearly, right?
There's no limit. And
Like, can't you get Botox in your hands, too, to make your hands look less old? Is that a thing, or is it
it's
filler?
more filler, yeah. You can get
Okay.
it for sweating in the hands, on the palms of the hands, underarms.
What about just, like, when your hands look like a 70-year-old like mine?
No, well, the thing is we take such good care of our faces, right? We're putting on the creams, the serums, but we forget. Backs of the hands. Add it to your list.
Yeah,
Putting your
that's
vitamin C on your
true.
face, just rub it a little bit there.
Ooh,
if it
that's a good
bothers
idea,
you.
actually, yeah. Like after you got that excess on your
Yeah.
hands from putting your nice expensive face cream on, just
Exactly.
give a little love to your hands, guys.
Yeah, if that's what bothers you, you go for it.
That's it.
There you go, you got it.
Yep. It's my
Yeah.
new to-do.
But yes, they use Botox everywhere. They use it actually in the bladder for people. They use it in joints sometimes.
In the bladder?
For
How do you
tone
get
and
to that?
if you're getting a ton of bladder spasms, just to relax. Like
You
it's
just go through the skin right to the bladder?
no.
Oh, okay.
I don't know how they internally get there above my scope of practice, but yeah, Botox is so widely used. So I know there's a lot of fears out there because it is a toxin, botulinum toxin, but it's also one of the most studied drugs out there. And
Yeah, I love it.
used.
I'm all for it.
Yeah.
Pro Botox right here.
Exactly. Me too. I
Yes.
think if you're going to do anything, that's where you can start.
Yeah. Just a little bit in your RBF there.
Yeah, exactly. So I came up with some of the most common questions that I get because I know that's what people want to hear.
Yeah,
They know
totally.
nothing, and you know what? That's totally okay. I knew nothing before getting into this role too. So we all
Yes.
start somewhere.
Yes. And I mean, you are an expert. Like
I am,
you own your own
yes.
practice. You're a nurse. You're like,
Yeah.
I would say skincare expert.
Yeah, exactly.
We can
I'll
put you in
take
that
it.
category for sure.
Exactly. So you're right. I own my own business, and my business is maybe a little bit different than others. We all have our own clientele, our own demographic. So I'm just going to speak directly to my clientele and my demographic and who I treat, which is not everybody, because I strongly believe in less is more. I'm the one that's going to say, nope, we're not doing any more lip filler. I don't want to do any more to you. It's not looking natural anymore. We want to keep things natural and simple.
Oh, yes, like those women in the UK.
I
Who is not telling them to stop?
Exactly. And I do know that there's people out there who want the money, so they continue to inject. I do not treat that way. Has my business been slower at the beginning for it? Sure. But I am totally okay with that because I have my clientele. I think a lot of women, and I felt the same, that I don't see myself as looking at like some of these injectors out there, these people getting all of these injections that you see on social media. That's not me. And do I belong in this? Do I belong getting these? But you know what? There's a place for everyone, and there's a place to just start. And that's why I started this business, because you don't have to go that extreme to feel a little bit better about yourself. Just do a little bit here and there.
They look ridiculous.
Exactly.
They got two big hot dogs on their mouth.
Oh my goodness. I have some clients that tell me, oh, don't let my lips enter the room before I do. I'm like,
oh my God, no kidding.
I know. And I think it's just, people get blind to it, right?
Yeah.
They get blind, they get used to it, just like anything else on their face, on their body. You get used to what you see, and then you can look back 10 years and you're like, oh, why did I do that? But we don't do that here. Anyways, I digress. Some of the most common things that people ask, because they're all new. Like, I treat new people to aesthetics, people that have no idea what to expect. So the difference between Botox and filler, that's number one.
Yes.
Botox is a muscle relaxant. So we are putting the drug, the toxin, into the skin, into the muscle. So Botox is also called neurotoxin. You'll see both. Botox is the brand name. It's like different brands of apples. So there's Botox, Nuceiva, Dysport, all of them. A lot of people use Botox because that's what people know what it is.
Yeah.
But all of them are a neurotoxin. So it goes into the skin, into the muscle, relaxes the muscle, and then within 4 hours, it's not there anymore. It's done its job. Over the next 2 weeks, you're going to see those muscles start to relax. They're going to be like, okay, I'm not going to move anymore. So whether that be pulling your eyebrows up or making that angry face, it's not going to happen. This is not a permanent thing by any means. It lasts about 3 months, depending. Some people get 6 months. It depends on what you're wanting. Do you want to be frozen, or are you okay with movement? You just don't want those deep lines, which is the majority of my clients.
Yeah.
Do you have to continue after getting it done the first time? No. If you don't like it, don't continue. You do you.
So when the toxin goes in, it just essentially, after it's done its job, digests out of your body like anything else. Okay,
Exactly.
okay.
And that's why we have some rules for after about 4 hours. You don't want to rub the area because it can move. It's a thin fluid. As we age, unfortunately, all the fat that we have in our cheeks comes down, which is when we can get the jowls. So people like fillers, of course, in their lips, but in their cheeks, for structure, for jawline. It can go a lot of different places.
I would say that my favorite is the little bit of filler I've had like in my cheeks to reduce the sunkenness of my eyes.
Exactly.
That just tiny little bit has made a huge difference.
And it's also my favorite treatment too.
Yeah.
My clinic, we don't do under eye filler. It's just a preference that we have. It's not very good for a lot of different people. We've had to dissolve bumps and bumps, discoloration. There's also a lot of high risk. There's a lot of risk to filler. We're a low risk, low liability clinic. We don't want to take that on.
Yeah.
We want to keep you safe. So we do find just by adding a little bit into the cheeks, it lifts everything up, your whole face. You just look more refreshed.
Oh, absolutely.
You're not going to have those sharp cheekbones that you see out there. That's not what we're looking for. We're just looking for a little bit of lift.
Yeah.
filler stays in your body for about 9 to 12 months. That being said, there's now new research that does it fully go away? No, it can spread to other places and disperse. What is filler? Filler is a hyaluronic acid. So we also already have hyaluronic acid in our bodies, so it's just a gel substance that we put back in.
So it's natural. You could call it organic.
Yeah, it's organic.
Yeah. Yeah.
Exactly.
It's better for the brain.
Yeah, exactly. Don't think about all things. But there is a way to dissolve. So with filler, we do have risks, but there's ways to take it out. So you're not stuck with it forever. Just if you're getting filler done, make sure that your injector goes through all the risks, all the things that you need to be aware of for after.
I have a question about dissolving the filler, because I've never had to have it done, obviously, but I do hear people who have had it's quite painful.
No, actually,
That's a myth.
that's more likely a myth. It depends on the body, though, and it depends on the person. I've had some filler dissolved before. I didn't think it hurt any more than filler itself. It's the needles.
So it's just like a counteractive.
Yeah, it just goes in and breaks everything up. There is more swelling to it because your body's like, oh gosh, what's happening?
Yeah.
And there's no, in filler, when we inject it, there's lidocaine, so it's numbing along the way. In the dissolvent, there's no lidocaine, so you're still going to have some pain. I still numb. I know some people don't numb. I provide numbing.
Yeah.
It's quick, in and out. Another thing that with dissolving, now that we're on that subject,
Yes.
women who have had a lot of lip filler get migration. So it can go, like I said, somewhere that it's not placed, it disperses. So they feel like their lips are not as plump. We can do a little bit of dissolving above the lip as well, and that can help bring your lip back to looking a little bit more plump. So instead of adding, we take a little bit away.
Oh, okay.
That's also pretty popular these days as well. And I like that. And we don't want to keep adding. We have to look at the full face and how is it looking balanced? Is it too much?
Yeah.
From there.
Interesting.
Yeah, exactly.
A little can go a long ways.
A little can go a long
Yeah.
way. And you can always add. It's very hard to take away. With Botox, you can't take away. So we start slow.
Yeah.
Love it. We can always add in 2 weeks.
Yeah.
Go from there. How do I know what treatment's right for me? I recommend having consultation. Just come sit and chat with one of us. We can help direct you.
I'm so impatient, though.
The thing
If I
is,
come for a consult, I'm like, okay, let's do it then.
then let's go.
Let's
And
right
we
now.
can. With Botox, we can. Book a consult if you decide at the time. Botox, it's such a quick treatment. It's like maybe 10 minutes. We have time to chat about everything and then continue if you want to. But let's talk through it. There might be a better way than going straight for 10 syringes of filler. Start slow. We'll let you know. And don't ever feel like you have no idea what to expect, what to do, so you come in with all these nerves. We're happy to talk you through it. We've all been there where we had no idea what any of this stuff was.
Oh, yeah. The first time I went, I had like the squeezy ball and the little vibration thing on my face, and I was all nervous. And now I go in there and like the last time you touched up my one side of the lip, I didn't even have any numbing.
No numbing.
Just like a seasoned pro now. That's right.
We get in our head a lot with like, I don't belong here. Why am I here?
Yep.
Am I too far gone to start any of
Needles
this?
make me nervous. Yeah.
No, just come chat. We probably have options. I have clients who are in their early 20s to 80s. It's never too late to start. We're happy to help and talk about your skincare needs.
Yeah, it's not as scary as it seems.
All you need to know is when you look in the mirror, what bothers you the most? What is preventing you from showing up to be who you want to be in the world?
Yeah. Can it be fixed?
Can
Is
it
there
be
a solution? Ask. Why not? You don't know.
You don't know.
It's not a
Maybe
no if
it's
you don't
simple.
ask.
Yeah, exactly. Exactly. How much does it hurt? And Jen just spoke to it. Like, it's not too bad.
It's a small pinch,
Yeah.
honestly. Like, I would say
Lip filler is different.
the lips were a little tender, but nothing crazy. Like a little eye water, but still manageable.
Exactly. And Botox, half the time, people don't feel it. Some people are a little bit more sensitive. We have options, though, for that.
Botox is like nothing. Yes.
Yeah.
Well, I mean, beauty is pain.
Mm-hmm.
Sometimes.
Exactly.
Within reason, obviously.
And it's not like, okay, I did the needle, it's going to hurt for the next week. No, it's in and out. Sometimes people feel a little headachy after their first time. Tylenol works well. That's it.
That's right. Yeah.
Will I look natural? That's my goal. We never want people to leave feeling like, oh, someone's going to know what I had done.
Well, look at us. Do we look natural?
Yeah.
Can you see us?
I personally do aesthetics, Botox, so that I don't have to wear makeup, that I can just get on with my life. And
Yes, me too. I don't got time.
the worst thing for me is I hate washing my face. It's such a chore for me. So this is not something I should be saying, but I wash my face once a day, and that is it, and that is fine.
Yes.
But I don't want to put a whole bunch of makeup on, too, at the end of the day that I have to scrub and, like, chisel out. No.
Yeah.
You do you. Don't ever feel weird coming to talk to us and being like, I don't wash my face ever. So, you do you.
You should. But we're not going to judge you if you
No,
don't.
we're not.
Okay? But please, you should wash your face. And, I mean, if you're a makeup wearer, just a cheap oil cleanser
Yeah.
is all you need to get that
Just get
makeup
that
off your
stuff
skin.
off,
And
yeah.
it's very quick. It doesn't have to be expensive. And you can just use a little natural, like a, not natural, but an oil cleanser to get all that nitty gritty off your face. And then just slap whatever lotion you got on there after.
Exactly.
It can be low maintenance. We will
You can.
give you lots of recommendations if you want. But yes.
And that brings me into my next question that I always have is difference between medical grade and store bought. Is there a difference? Yeah.
For sure.
Medical grade, it is scientifically researched. It has a drug number attached to it. Any claims that it makes, it has to be scientifically proven. Store bought does not.
Yeah.
Does it still have good quality stuff in there? Yeah. But is it going to make as big of a difference? Probably not. It's
Well, there's probably lots of filler crap in there too.
Exactly. It's not going as deep
Yeah.
into the skin. Do I recommend going out and buying all the medical grade stuff? Absolutely not. No, who can afford that?
No.
Keep it simple, guys. If I'm washing my face and I know I have a 10-step routine after, it's not going to happen.
Yeah.
Vitamin C serum, a good cleanser, a good cream.
Well, you
Sunscreen?
sell a brand in your salon or in your studio.
Yeah, Vivier.
Yes.
Mhm.
And I don't use the whole line.
No.
But you have recommended a couple things to me that I could add to my regime. And I love just those couple products that I've invested in. I don't need a lot of them. Cost me maybe a little bit more than the store did, but
Yeah.
they've lasted a long time. And I've just implemented a couple small things into my own skincare regime. And
Exactly.
I love it. So it doesn't have to be the full wham bam, thank you, ma'am.
No, and because it's so concentrated that you're using such a tiny amount. So
Yeah.
it's going to last 5 months compared to every month you're buying something new.
There's one that you recommended to me for my redness.
Mm-hmm.
Midlife redness. I don't know if this is
Hormone, yeah.
the hormones, the perimenopause, the skin tone, the sun damage, whatever the case may be, but the redness.
Mm-hmm.
And yeah, Shay recommended one of her products from her line that I used to take away the redness. A small little like pea-size amount I use in the morning,
Yeah.
and it has made a difference. I was supposed to document my change, and I did not, but I will say it now.
And that's totally fine. Life gets busy.
Which one was it? Do you remember?
Yeah, it's just the redness.
Literally for
Vivier-
redness.
Yeah, Vivier redness solution.
Yeah, I
amazing.
recommend that one. See Shay, get hooked up if you're having redness problems.
Risk side effects. Of course, there's risks and side effects for everything. Talk to your injector. We're putting needles into your skin. We need to know your health history before injecting to make sure that it's safe to do so. There's some risks. It's not huge though, but we want to discuss it and chat with you about it. So let us know
Yeah.
what health history you have, and then we can go. The biggest one is like for Botox, bruising, bleeding, infection. We're going into your skin with a needle. That can happen.
Yes. I've had the bruising,
Yeah.
a little bit of the bleeding.
Typically, with Botox, makeup covers it up the next day.
Yeah.
Don't worry too much. Filler, whole new ball game. Chat with your injector.
And if you take good care of your skin, and your body, and you're a healthy individual in general, those risks are probably significantly lower than...
And if you follow our rules for after,
Yeah.
no laying down for 4 hours, don't rub the area.
Yes.
Those are some big ones. Follow them.
After the lip
Then you'll
filler, no aggressive making out.
No making out. We don't want bacteria in there.
That might deter all the husbands from wanting to support in the lip filler area, but
Not for very long, just for a couple days.
just a couple days.
Yes.
Okay, great.
And then, do I need to prepare for your treatment? The big thing is, if you don't want to bruise, that scares you, don't drink alcohol. We don't want to thin your blood.
Yeah.
Advil, anything that thins your blood, stay away from. Work out the morning of. Don't work out after your treatment. Don't go to the dentist after where you're laying flat. Your injectors will give you a list of things. It's not crazy, though, by any means.
It's kind of common sense stuff,
It
though.
is.
It's pretty, makes
Yeah.
sense, right? You just had a needle in your head, so don't,
Don't go
rub the
to
area.
jiu-jitsu right after.
Go running your head into a mat while you wrestle people.
Exactly. But those are some of the common questions that I get. Just know that no question is stupid. No question is going to make you should make you feel embarrassed to ask.
Do you have to arrive looking 10 out of 10 to your appointment
No.
because it's a skincare clinic and people are supposed to be looking their best? No, absolutely not. Can you arrive in your pajamas
Exactly.
and your prettiest sweatsuit? Yes.
That's our best clientele. That's our favorite
Yeah.
people because you're showing up as who you are.
Yeah.
And I love that.
Yeah.
I'd be the same.
The more natural, the better.
Yes. Everyone is welcome.
Yeah.
Don't worry about looking a certain way.
Roll
acting
in like a
certain
slob and walk out like a Barbie.
way. Glowing. Exactly. That's what we wanted to push on this episode. That if you're interested in just starting to take care of your skin, that you belong in these clinics. You belong to take care of yourself, inside and outside. Starting small, going big if that's what you want. You go for it. Everyone's welcome.
Yeah. Doesn't have to be big. Just the littlest bit can make a big difference in
And
how
no
you feel.
pressure. We're not here to pressure you saying you need all of these things.
Yeah. Not at all.
We don't. If you want to use your skincare that's been working for you for the last 10 years, you do you.
Yeah.
I will help with some Botox. If you want recommendations, we can help. But we're not here saying, well, if you don't do this skincare line, then you're not going to have any results.
No, not at all.
No.
We are saying you should wash your face, though.
Yeah,
Please.
once a day.
Once a day at the very least. And then use whatever skincare you want after that.
Exactly. It'll help. All those little things do help with your Botox, with the way you feel, with the way you look. You're taking care of yourself.
Yes.
You're prioritizing yourself in your midlife to make those small little changes to show up.
And feeling confident in the way you look reflects the confidence you feel within, honestly.
Yeah.
You just present yourself a little bit different when you feel good.
A little bit better, yeah.
Yeah, a little bit better.
I
So
agree.
something small can make a huge difference to how you feel on the inside.
And I totally feel like you're going to show up, you're going to love it, and you're going to start adding to your life a little bit too.
Yes, you are going to love it.
Yeah.
We'll tell you that.
Yeah. And it's not as expensive as people make it believe.
No, it doesn't have to be for
It's not
sure.
going to be $1,000 every 3 months
No.
in my clinic.
No.
So come chat. No pressure. I do have to say, though, a little side tangent, that we have these ideas of how we should look to be able to show up, too.
Yes.
You can look however you want to and show up and still have that confidence, but it's all about you and what makes you feel good.
Yeah, we talked about this a couple episodes ago.
Yeah.
You don't have to be in shape before
No.
you go to the gym.
You just have to start.
Yeah.
You don't have to be a certain way to get injections. You just have to start.
You don't have to have the certain outfit that, the other moms at the rink have or whatever the case may be.
Yeah, I need to learn all that, though. What do they wear?
Sweatsuits, warm things.
Yay! Perfect.
Yes.
My
Invest
favorite.
in a great matching two-piece.
Perfect.
I'm always Aritzia because it's my favorite. But I feel like a good matching two-piece sweatsuit,
Okay.
You can always like throw a pair of earrings on, a cute little pair of shoes, and be warm and cozy. You do not want to be uncomfortable in the rink.
No.
Let me tell you that, because the bleachers already uncomfortable. If you're cold, then you just look stupid. Yeah. So if you're cute and cold in the rink, you just look dumb.
Yeah.
So
Okay, good to
be
know.
warm and cute in the rink. Okay.
Got it.
That is my recommendation. But yes, layers.
Layers. Wonderful.
Yeah.
Got it. Well, I hope you guys have a good week.
Yeah.
I think that's all we have. If you have any other questions, though, feel free to leave us a comment, a message.
Yes. We
We're
want some
happy
more
to answer.
engagement. Comment. What type of topics do you want us to talk about?
Yeah, we're happy to chat. We have a lot of fun things coming up.
Yeah.
But we want to hear what you want to hear.
Have a good week.
Okay.